Hello everybody, today you're going to learn some exercises that are going to help you to prevent the tightness that you experiment after surgery in your breast area or also after radiation. It's very common to find patients that are, after they had surgery, they're going to complain about that bringing the arms are very difficult because these muscles are pulling, especially when you bring the arms over your head or to the side. So these exercises are going to help you to prevent that tightness, and also it's going to help you with pain too. What is happening is when we have a scar, everything starts closing and pulls around it, so it's going to start feeling thicker, tightness, and sometimes even heavy. So make sure to ask the doctor if it's okay to start the exercises, and let's start right now here. These exercises are going to be lay down on your back because this is the most comfortable position when you are dealing with the healing, and we have to respect the healing process. We have to listen to the body. If you are having pain, go before pain, don't force it. So let's start with the first exercise. So you're going to lay down on your back, and we're going to start with diaphragmatic breathing. So diaphragmatic breathing, so what are we going to do? You're going to bend your knees in a very comfortable position. You're going to put your palms up, and you're going to start inhaling, and when you inhale, you're going to expand your abdomen, and when you exhale, you are going to deflate your abdomen. We're going to do it 5 times. Inhale, exhale, inhale, expand your abdomen, exhale, deflate the abdomen. Number 2. Inhale, make a big tummy, exhale, deflate the abdomen. Inhale, exhale, inhale, deep abdomen, exhale, deflate the abdomen. It's very important, the breathing, because that breathing is going to help you to have a better awareness of your posture. The second one that you're going to do, the same breathing, but this time during the exhalation, you are going to make a double chin, and you're going to flatten your lower back. Always I say this is like a shy dog that's breathing the tail in. So you're going to flatten the neck and flatten the lower back. When you do that, you're going to feel a gentle stretch that's going to be from the top of your neck all the way down to your back. If you don't feel it, no worries, because it's still stretching the deeper muscles of your muscles. Redundant, right? Okay. So you keep your hands again facing up. And inhale, big abdomen. Exhale, double chin, flatten your lower back. Inhale, expand abdomen. Exhale, double chin, flatten the lower back. Inhale, relax the lower back, expand abdomen. Exhale, double chin, flatten the lower back. Inhale, relax lower back, big abdomen. Exhale, double chin, flatten lower back. Inhale, relax your lower back, abdomen, relax. Exhale, flatten the lower back, double chin. And relax. 5 repetitions. The first one is just the standard breathing with the emphasis on making a big tummy. The second one is double chin, lower back, flatten. So that start giving you an awareness of your posture, and at the same time you are working on the deeper muscles of your core, so you are waking up those muscles to help you with a good posture. Okay, now we're going to do number 3. So you're going to put your hands on the sides of your thighs, like here, in this position. So with the elbows straight, the movement that you're going to do is, imagine that you have you're going to say, I'm trying to think what would be easy for you. Okay, imagine you are going to say hello to the sun. With the other patients, what I tell them is like you're going to hold a big ball on top of your head, and then you release the balls or the ball and put the hands again on the groin area. So with the hands rotated. So the movement that you're going to do is open the hands and close the hand. Another thing that I tell my patients is, imagine that you have some seeds and you're grabbing some seeds, and now you're going to throw the seeds to the sky. How about that? That one is better. Okay, so the breathing is very important. So when you do the movement, you're going to exhale. So you prepare with inhalation, grab the seeds, exhale, throw the seeds. Number one. Inhale, go and grab more seeds. Exhale, throw the seeds over your head. 3. Inhale, go and grab more seeds. Exhale, release the seeds. Number 4, go and grab more seeds. Exhale, release the seeds over the head. Open wide. Inhale, grab more seeds, and exhale, release the seeds. So this exercise is very important to listen to your body. So you're going to go and probably you feel like you are restricted here, that you cannot go any further. So that is how far you're going to go. And so you feel the restriction, so you go there, and you will see that daily you keep doing it, you're going to start going farther. At the beginning, the body tends to go just like in this position to 90 degrees, and later it's going to start loosening up. Okay, now we're going to go with one more and actually two more. So the next exercise, you're going to put your hands behind your neck. So with this one, you're going to start with the elbows up, inhale, and when you bring the elbows back, exhale. And you're going to try to make sure that the elbows go all the way back. So that's going to feel the stretch in the pectoral area that is tight. So ready? Inhale, exhale, open. Inhale, elbows toward the ceiling. Exhale, elbows go open. I call this one like the butterfly movement. Inhale, elbows up. Exhale, elbows open. Inhale, elbows up. Exhale, elbows open. Inhale, elbows up. Exhale, elbows up. So these exercises, like I said, do it every day. It's just 5 repetitions each. Listen to your body. Respect your healing time. So go slow, gentle, always combine with breathing, because breathing is very important. It's essential for muscle relaxation and also for improving the postural awareness. Now you're going to go on the side, and you're going to put again the hands behind your neck. So this time what you're going to do, you inhale, and exhale, you're going to bring the arm to the side. Inhale, elbows together. Exhale, arm to the side, and rotate your middle back to your upper back. Inhale, elbows together or a little bit close. Exhale, elbow rotate a little bit your upper back, middle back. Rotate your head too. Inhale. Exhale, rotate, rotate, rotate. Listen to your body, don't force it. Exhale. One more time. Inhale. Exhale is when you open. And inhale. Let's give one more. Exhale. So these are 5 exercises that are excellent that you can do every day. So remember, what are they? The breathing, making your body like a C, flattening your neck, flattening your lower back, grabbing the seats and throwing the seats over your head. The butterfly movement. And to the side. So these exercises, I would say do daily, and that would be it's an excellent warm-up. It's an excellent exercise that's going to bring more blood flow and it's going to help you with the healing. It's an excellent exercise that's going to help you because you're going to be active, so it's going to help you with the pain, reduce the pain. It's going to help you to reach, to grab something that is on top of maybe the shelf or something. So it's going to be very functional. So please don't forget to subscribe to my channel. If you have questions, if you want to learn something new, just please write it down. I'd love to answer all these questions and be able to help more people to have a better quality of life, be able to use your arms in a very safe way to go with you in the process of healing. And remember, don't forget always to ask your doctor when is the right time to do exercises, or ask your physical therapist how to gradually include exercises in your life. Okay, I hope you love this video. Share this video with people that will get benefit. Have a beautiful day and see you soon with more videos.